So we've just had someone ask, how do you deal with making mistakes in medical school? I think, I don't know if you mean as in, I guess, like failures and things like that. So I guess you're used to sort of being like high achievers, and then when you get to medical school, everyone's a high achiever, and you don't always get things right, and you might fail a couple of exams. So I remember when I was at my first year in medical school, I think I failed like 1 or 2 exams at the end of my first semester, and that really put me down, and I almost felt like it was the end of the world. But then you have to realize that those failures that you have and those mistakes that you make you stronger. And at the start, it's something new that you're doing, and you have to try not to be too hard on yourself, because you're going to settle into it, and even if you have a couple of failures along the way, that's going to make you into a stronger person. And you've got like friends who are going through the same thing, and they can support you, and the tutors at university as well are really supportive. And it's okay to make mistakes or to fail at something, because it's only just going to make you a better doctor at the end of the day. Let's see if there's any questions coming through.
Just to add to that as well, the best time to make a mistake is whilst you're a medical student, whilst you don't have that responsibility of the patient on your shoulders. So this is a time to get everything wrong, so that you can get everything right when you're a doctor. So don't be afraid at all of making mistakes. So this worth, it's even when you're a doctor and you make a mistake, there's always time for reflection and always time to get better at what you're doing. But just remember that it's easier to make a mistake as a medical student and learn from it than it is when you're a doctor. So just use that opportunity to motivate you through things that you might make mistakes on, because it's not all bad.
Do you want to as well, Annie?
Yeah, to chip in a little bit on that question, it's a really good question to ask. I think like probably everyone that is in this chat, from attendees, and Halima, Amina, Fuzzy, and myself, we're all high achievers in school who've gone to medical school. I had a phase of about 2 years of medical school where I kept failing exams on the first occasion. I was able to pass in resits, but it really doesn't. It knocks your confidence really a lot. But it helps you grow as a person. I graduated in 2016, and I've been a doctor now for over 4 years, and I'm well on my way to my eventual career goals. And I think, unfortunately, one of the things with medical school is you go from being a big fish academically in your pond of school, and suddenly you're in a much bigger ocean or lake where everyone is of the same level, and that can make it quite. I think exactly what Amina and Halima said in the talk is really important, to focus on yourself and your other things that you do and are really good at as well, because it can be really difficult to lose your identity sometimes in med school, and find that thing you're good at. But I think failure is unfortunately a part of life, and it helps you grow as a person. I remember a consultant told me on one of my first days of working as a doctor that you're not making mistakes, you're not doing medicine properly. And I don't mean you should go out of your way to make lots of mistakes and do lots of things wrong, but it's just the whole idea that you're always going to be pushing yourself, in this course that you're going for. You're going to be pushing yourself both when you're studying, when you're taking care of patients later on down the line, and unfortunately, because of that, mistakes will happen sometimes, and it's just important to reflect and learn on them. I'll pass you back to Amina and Halima.
Okay, so we've just had another question. So, did you find the jump from sixth form to university difficult? And absolutely, definitely. Well, it is difficult because it's such a big change, and that's normal, because anything that you do in life, especially a big change from college to university, is going to be difficult, and it takes time to adjust to it. So one thing I would say, it is difficult, but you adjust to it. It takes a couple of weeks and you just find your feet, and you make friends, and you get used to the teaching style. You get used to how you revise best, and even the first couple of months, you get used to it and you find what works best for you. And there'll be times where things seem impossible, but you will be okay. And before you know it, like 5 years have flashed and you're already in final year. So it is difficult, but definitely doable. And there's so much support as well from older years. So they are really good mentors, and they'll give you advice on resources to use, and on their experiences. Would you like to add anything, Halima?
Yeah, I was just going to say, as Amina said, it is a big jump. Even just the environment, like I said, you're going from a class of 30 now to a lecture theatre of 300 people. And so even the smallest things to the biggest things, there's a change. But that's all part of university life. And as Amina said, you'll always adjust. And even after second year, once you've adjusted to lecture life, if you want to call it that, then you go into hospitals. So now again, you're adjusting to a new environment. But one thing you will become better at is adjusting quicker to the different environments you're in. And also when you're a doctor, you're not going to be working in the same hospital throughout your career. So you're always going to be adjusting. There's always new things to learn about different hospitals, the way they do things. There's always differences. So just take medical school and the jump that you have from sixth form to university as something that's preparing you for further adjustments in life. But yes, it will be difficult because there is a big change, but just take it easy and don't be too hard on yourself, and just try and find your feet, like Amina said.
Okay. So how big of a jump is it from A levels? So I guess sort of a similar question, but in terms of the content, so it's a lot more content, but I wouldn't say that it's too, like, the content is manageable, as in it's not too difficult, but the thing is that you have a lot of content, and a lot more hours than you would experience at college, and it's just trying to find that balance to try and, I guess, learn all that content, and balance life with medical school.
Yeah, I know sometimes teachers say like A level is one of the hardest years that you will do in school, but in terms of medicine, there'll always be a lot more content that you'll be learning compared to other courses. So your A levels is just really preparing you for university, but it's all doable, and we've been through it, and so has everyone else. So the workload is definitely something that you can manage, and don't get put off by that. But in the beginning, yes, it will feel like quite a lot, and you'll always feel behind, and you'll always feel like you're not on top of it. But even we still feel like that now, and I don't think there's ever a point when you're a doctor where you feel like you know everything, because you're always learning. And medicine is not one of those careers where you get the degree and the education and the knowledge end there. You're always developing and you're always learning. So have that mindset from the beginning, so you don't put too much pressure on yourself.
I'll throw a question at you, Halima. Are there any overused phrases used in interviews that we should avoid?
Okay, so in interviews, one of the things I think that can be overused sometimes is knowing that you want to do medicine ever since you were really young. Although it might seem quite unique to you, quite a lot of people say that, and quite a lot of people mention that. So if you have a personal story, then definitely feel free to share that, because that does make you stand out, because that story is personal to you. But just using phrases like, I've wanted to do medicine ever since, I don't know, well, don't say this, but ever since I watched A&E on the TV, or ever since I don't know, watched a program, or something like that. So that definitely gets overused. I would say other things that get overused, just have to think a bit about this one. I think everyone always talks about that they have a passion as well. So the word, it's not a phrase, but it's a word. Everyone always, a lot of you might have already used it in your personal statement, and I was the same. But the word, I'm really passionate about this, or that gets overused quite a lot as well, both in interviews and personal statements. Those are the two things I can think at the top of my head. Amina, I don't know if you've got anything more to add to that.
So I guess just stating that I have this skill, I have that skill. Like I wouldn't state things. I would try and prove, like, how can I prove that I have that skill? So use your experiences rather than just stating loads of different words. I think you need to really explain what you've learned from your experiences. So I think that's, I guess, one sort of common mistake that people sometimes make. So really try and say what you've learned rather than that I have this skill or that skill.
Mm-hmm.
So how do you deal with self-doubt and second guessing yourself? So that's actually quite a really good question. I think even still till this day, I'm still sometimes self-doubting myself and second guessing normal. And I think I remember like starting medicine in first year and being, I guess, the first person in my family to do medicine. Halima's the same as well, and coming from that widening participation background, you do sometimes doubt yourself or feel like did I deserve a place in medicine? Am I good enough to do this course? And those are completely normal things to feel, but just remember that you've earned your, you will have earned your place at medical school, and you know, like, you're working hard, and try not to be too harsh on yourself, and believe in yourself, because like positive thinking really makes all the difference. And talk to your friends as well, because a lot of the times your friends are feeling similar things that you are feeling, and you can share with them, and you know, you've got friends and family and a support system who are there to support you, and even tutors as well. And the worst thing you can do is keep yourself, because that won't be good for anybody at all. Anything to add, Halima? I think you might have frozen there. No, it's okay. Let's see what other questions we have. So are dissertations given often, if at all? So our medical school, no, so you don't have dissertations, so it's all pretty much like we were mentioning, MCQs, OSCE exams. But however, saying that, if you take an intercalation, you do have to do a dissertation. So I've got a dissertation to do at the end of this year, which I'm not looking forward to, 12,000 words. So yeah, I guess you get off lucky not having to do a dissertation. Okay, so is there a certain amount of work experience or volunteering you're expected to have done when applying for medicine? So I guess now it's quite difficult for you to do work experience because of COVID. So don't worry too much if you haven't done as much work experience as you wanted to. And I don't think you have to do a particular amount of work experience, but Halima, you're back with us now. I don't think you have to do a particular amount of work experience, but it's more what you gain from that experience. And saying that as well, look at the universities you're applying for, because some of them might have a particular work experience that they want you to do, or particular volunteering that they want you to do. And there's loads of online work experiences. So I think the Brighton and Sussex Medical School have a free virtual work experience. I think the Royal College of GPs as well, they have a free virtual GP Observe work experience. So there's loads of online opportunities for you to do. But I think the main thing is just what do you gain from that, and what do you learn from that, rather than having a whole list of work experiences. So Halima, in terms of, so the question that I was just answering was, is there a certain amount of work experience or volunteering you're expected to have done when applying for medicine? Is there anything that you'd like to add?
Yeah, so sorry guys for cutting out, but I'm back now. So in terms of work experience, I actually didn't get any work experience in a hospital prior to starting medicine, and I hope that reassures some of you guys, because I know it's so difficult now, especially now, actually, to get work experience in hospital. But one of the things that is overlooked is that they want you to have work experience in a healthcare setting. Now, this doesn't mean hospital. This also includes care homes, so seeing how they manage elderly patients, or special needs school. They're also healthcare settings, and they're very valuable work experience for you guys. So don't just focus on hospitals, and they certainly won't look down on you if you haven't got hospital experience. It's ideal, but you do have, there's a reason why you have clinical years in medical school. You're not expected to get all of that experience and be a doctor before you even start. You will get your hospital experience later on. So that's not absolutely essential, but what they do want to see is that you have an interest in medicine, and you've used different services, so that could be through work experience, through your research, to affirm your decisions to study medicine. So you need to show them why you are the right person to study medicine, and how you know you want to study medicine. So I've done this work experience, I shadowed this doctor, or I went to a special needs school and I saw them managing the care of primary school age children, and that really interested me. So I did my research on this, and then I attended a medical student webinar, like for example Mesuccess, that also counts. So just talking about linking those experiences. So that's the reason why they want to see work experiences, because they want to know that you've been in an environment where healthcare is provided and you understand the role of a doctor, or the role of a healthcare professional. So it doesn't even have to be a doctor, actually. So that's really the real reason. So don't bog yourself too much if you don't get that hospital experience, because I didn't, and it was fine.
Absolutely. So another question is, would you know by any chance if the medical interviews for this year will be face-to-face or online? So I guess it will vary between medical schools. So I'm not aware of that, but I'm sure they will update that on their websites or via emails. But Mesuccess will hopefully, after this webinar series, be doing online for us, and we'll advertise that, and that will hopefully help you if there are any online interviews. Okay. I think we've got some questions from Facebook as well. So Halima, I'm going to throw one at you. Is the workload of A-levels harder or easier than uni?
I think we touched on this question a little bit before. Personally, from personal experience, I found A-levels a lot easier than medicine. That's not to say you all will, or that's how it is, or that's how it's meant to be. But for me, on top of the work, I was also commuting, so that made it more difficult. So it's not just content-wise, but also the fact that for secondary school, it took me 10 minutes to get there, whereas for university, it took me an hour and a half to get there. But obviously, if you're living in accommodation, that won't be an issue. So in terms of that respect, yes, I found university work a bit more difficult to manage, but I did get through it. And if this is some reassurance to you guys, I'm not that person who's always on top of my work, as Amina will probably confirm. Actually, we both are like that. We're never on top of our work, but we've got through it, and so that should hopefully, we've got through it. So hopefully that should provide you guys with the confidence. You don't have to be the smartest in the class, or always on top of your lectures, or you know, always knows exactly what you're doing. You have your notes ready before the week even starts. No. That's probably not going to happen anyway, but yeah, definitely taking in Amina as an example of people who are a bit more laid back, and not your typical medical student stereotype.
Yeah, definitely. And don't let even in A-levels, what everyone else is doing, don't let that intimidate you, because everyone learns differently, and everyone works better in different ways. So try not to like compare yourself, like Halima was saying as well. So we've also had a question from Facebook saying, do you recommend taking A-level maths? Not sure whether to keep this or geography. So I think this person is talking about possibly, is it when they're in second year and drop in a subject. So when I was at college, so I did AS Maths in the first year, and then I dropped that and carried on with economics because maths just wasn't for me. So I think for most medical schools you need biology and chemistry, so as long as you've got those, check obviously the entry requirements. Then the third subject, you know, you can do geography or whatever suits you, or if there's look at the medical schools you want to apply for, and if they have any other requirements, then go with that. But you don't have to do a subject if you're not a big fan of it, or if you find another one.
Yeah, and so for me, I did A-level chemistry, biology, and I did do A-level maths. The reason why I chose A-level maths was because obviously I'd done it at GCSE, and it's one of those A-levels that really teaches you different skills, and it's a bit separate to biology and chemistry, but there's no specific requirement for maths. And you won't be doing anything that you learn in A-level maths in the hospitals, so you won't be at any form of advantage anyway in that respect. So you won't be doing, like, I don't know, differentiation or integration on medication, but it is definitely a useful skill to have, and based on personal choice I went with maths, so that's what I would say. But it's just personal choice at the end of the day. My opinion doesn't really matter.
So someone's asked, are 4 A-levels worth it for medicine, or would I be better off doing 3? So I think you need just a 3 A-levels, so it has to be biology and chemistry and one other subject for medicine. So I think you need like a AAA prediction or A-star AA. So I would personally say, well, it depends if maybe you're interested in 4 subjects and you want to do that, or if maybe it's a particular university that you're applying for where you'd be at an advantage with 4 A-levels. But I would say make it easy for yourself and go with the 3. But I don't know, what do you think, Halima?
Yeah, so I had the same question actually. So I was also doing another A-level. So I was doing 4 at the start of the year, and then I really took the time to think to myself, will I be able to juggle everything? And then it all came down to it, and I thought picking up a 4th A-level will actually affect the grades that I achieve in the other 3 A-levels, because it's just too much workload, and I personally wouldn't have been able to manage it and still get my 3 A's for medicine. So I didn't do 4 A-levels, I did 3, but that made my decision. So what you need to think is, what's the benefit of this A-level, extra A-level that you're doing? Does the benefit outweigh the added workload and pressure and the fact that it takes time away from your other 3 A-levels? If the answer is yes, then you might want to reconsider whether or not you want to do that 4th A-level. If the answer is no, and you're amazing at balancing, not even amazing, but you're good at balancing your time and you know you can do it, then just go for it. Why not? But don't let it affect your other marks.
This is a question you're going to love, Halima. How do you differentiate between empathy and sympathy as a doctor?
Okay, so empathy means putting yourself in someone else's shoes, and sympathy means feeling sorry for them and feeling pity for them. And the difference between those two are, if you just think about yourself in a situation where you are in an uncomfortable situation or not very nice situation, you don't really want people to feel sorry for you. You just want them to listen to you and to understand what you're going through, even though they haven't been through that thing themselves. And that's what it means by putting yourself in someone else's shoes. That's the main difference between empathy and sympathy, whereas sympathy is like, oh, I feel really sorry and stuff like this, and no one really, like when you're going into placement, the patients don't really want you to feel sorry for them. They just want you to listen to them and, you know, have a bit of understanding of what they're going through, and I guess that's the main difference. I can't really expand more than that, because that's the 2 definitions that we've been taught.
Yeah, and in terms of like sympathy, and in those situations where it can be difficult, with time and with experience, you'll learn to be more sympathetic. So no one's expecting you to be perfect from day one. You will learn and pick up things along the way. Okay, I'm just going to scroll down in the chat box and see what other questions do we have. Do you think it's possible to work part-time alongside your university timetable? So during my first and second year of university, I did do some tutoring work on the weekends. So it is possible to work part-time, but I wouldn't recommend you to work too many crazy hours. So I would personally say 8 hours a week would be like the maximum, because yeah, it's possible to work part-time, but you don't want that to like affect your studies, because at the same time you need your downtime and you've got your scheduled teaching and you've got exams to prepare for. So yeah, you can work part-time, absolutely, and it is possible to, but just be sensible with the amount of time that you're working for. And again, even in holidays,
Yeah, definitely.
yeah, you can pick up on more hours during holidays.
Yeah, that's the one thing actually we didn't mention. So university holidays are the best holidays ever. Even if you're doing medicine, actually, there's a bit of a myth going around that when you're doing medicine, you don't get that many holidays, but you do. So in first and second year, we had around about 3 months off. So that's almost like the lockdown period, to be honest. And you get that off whilst you're a medical student, which is amazing. You've never had that much time off in your life since nursery, probably. So that's something to really look forward to as well. And I would say you get in your holidays, use it as holidays, because when you're a doctor, you really wish you use those holidays to relax rather than work. Your working time comes afterwards. That's not something you have to push onto yourself straight away, but definitely look forward to the holidays as well. Can't believe we forgot to mention that. They're
Yeah,
amazing.
definitely. Yeah, the holidays are amazing during the earlier years. So someone said, would A-levels in maths, chemistry and sociology allow me to go to medical school? Okay, so I think with that, I guess it depends on the university. So if you look at their entry requirements, and then email them in if it's not clear. But I think some universities do require some form of biology. So with that one, I would say definitely check the entry requirements for specific unis, and if it's not clear, email in. Anything else to add, Halima?
Yeah. No, that being said, I think majority of the universities do need A-level in biology for medicine, but things change all the time. And when we applied, that was 4 years ago. Always double check, but that was what it was when we applied.
Okay, so someone said, how many hours a day would you say you study for independently? So I would say that varies from day to day. With me and Halima, not too much studying, but what I would say is try and have like a set timetable, especially if you've got like a long day from 9 to 5 or 9 to 6, then have the evening to yourself. Weekends, they're usually free, so try and study. I would say like 4 hours a day, nothing more than that. And then during the week, I guess like 1 to 2 hours would be okay. But as long as you've got a schedule and you know that you're prepared and meeting all the learning objectives that you need to do for your exams, then that's the most important thing. And study smartly as well. So I remember like at the start of med school, because in A-levels I was used to making like pages and pages of notes. I realized that that's not going to work in medicine, because there's just way too much to be making so many pretty notes and stuff. And I guess a good thing as well, using a laptop to make notes makes life a lot easier, and then learning the content rather than spending like hours just making perfect notes. But yeah, no, even though you have like quite a bit of independent study, you still have time to do other bits and bobs as well. Halima, anything to add?
No, I think like echoing everything you've said, in terms of independent study, it really depends and varies. At the moment, I'm doing very little independent study. But it just depends really. Obviously you're going to factor in travel, and also when you're in hospital you're not just sitting at a lecture theatre. It does get tiring, and so I don't think you should say to yourself, I should do, like, for example, on the weekend it's fine, but during the week, if you set yourself like, I'll do 2 hours every day is different. You can't possibly be consistent with your independent study every single day. So just bear that in mind, because some days you'll finish hospital at 1 o'clock and some days you'll finish at 6:30, and there's no way you can do the same amount of work on both of those days. And same for lectures, actually. Some days you will finish earlier and some days you will finish later. So just plan around that and don't worry too much about independent study, because you are in med school you have lectures from 9 to 6 when you first start medical school, so that's a lot of study already.
Okay, so someone said, if you don't have any volunteering experience, will medical schools look down on this? So no, I don't think they will look down on it, but sometimes those who have volunteering experiences for certain medical schools, that will be more favourable for them. And some medical schools don't look at personal statements, and others have certain categories that they want you to meet. So if you don't have any volunteer experience, I wouldn't worry about that. Try your best to get some, because even because it not just to tick a box, but it will really help you as well, and help you to build some really important skills that you need to study medicine, and even during medical school. And I know it's difficult at the moment, but there are like online opportunities that you can look into, and I'll try and share some of those online opportunities on our social media. I'll get some links together and share that, because it is doable, like volunteer work, even in this current climate. And I guess I think the most important things that medical schools are looking for is that you're learning from the experiences that you have. So don't just do experiences to tick a box. You just need to ensure that you're learning and you're gaining, important skills. So I feel like that's the most important thing, and it doesn't matter if it's something non-medical related, as long as you're learning something from it. It's the most important thing. Halima, anything else to add to that?
No, I think everything that you've said and what we've said at the start as well about experience, just making sure that you learn from it, and you do it in a healthcare setting, you should be absolutely fine. But if you mean volunteering outside of that healthcare setting, it's always nice to have something to talk about in interview and to show that you are well-rounded and you have other experiences as well, but it's not absolutely necessary.
Okay, a question from Facebook. So Halima, do you have to write essays in medicine?
Yes, you do have to write essays, but actually quite pleasantly for some of you, and also myself definitely, you don't have to write many at all. So for us, we've probably done about 5 essays, and I'm in my final year now, so that's almost like an essay a year. So it's not like one of those other subjects at university where you'll be writing essays every week or every couple of weeks, but that will change if you do decide to intercalate. But essays, you don't really write many, and actually it really depends, to be honest. University of Birmingham, you don't. I know places like Oxford and Cambridge, they are quite heavy on essays. So that's something to look at actually when you're choosing medical schools, because if you don't like essays, then that probably won't be the best option. But yeah, don't worry about them at all. They're not that they're like frequent at all.
Yeah, and saying that as well, with the essays, you get a lot of support. So our university has sessions to help you with academic writing, and workshops, and personal appointments that you can attend to help with that. So yeah, in medicine, like Halima was saying, you don't have many essays at all. So when I started intercalation, it was a bit of a shock when we had an essay due in the first week. So yeah, intercalation, I guess, is an opportunity for you to develop your writing skills, but yeah, during medicine you don't have many essays to write, which I guess is a good thing as well. So Halima, I'm going to fire another question at you. How difficult did you find the UCAT or the BMAT?
So I did the UCAT and I found it really difficult actually. I booked it quite last minute thinking that will give me more time, but it just gave me more time to put it off. So yeah, I did find it difficult, and don't worry, a lot of people find it difficult. We will be having a webinar on UKCAT and BMAT preparation and giving you guys the best tips and advice collected from people who've done them before. So definitely tune in for that, because that's where you will get the most relevant information, because we've done it 5 years ago and I know quite a few things have changed since then. But definitely it was something that I found difficult, and don't think you're the only one if you find it difficult as well. And also if you don't get the best score as well, because there are a lot of universities who don't really focus too heavily on UKCAT, so don't worry about that in that respect. But I won't steal the thunder for the next presenter who will be talking about UKCAT, and you guys can tune in for that to gain some more information on how you guys can get the top best marks.
Yeah, for the BMAT next week, and I think it's a Cambridge medical student doing that, so that will be yeah, really exciting, and definitely tune in for that, like Halima was saying, top tips and how to get those best marks. And I think it's really nice to when someone who's been through it quite recently to talk things through, and it's all recent in their mind, and they can give you those tips that, and answer those questions that you're really looking for the answers for. So someone's just asked, how did you make your notes, or how do you revise? For me, I quite like watching videos. There's a lot of videos on YouTube and different medicine websites where they break down certain conditions and the content that you'll be learning in medicine. I also quite like watching webinars. They're quite like fun and interactive, and I like that, like a different way of learning. And then other things that I do like to do as well is use exam questions. So for multiple choice exams, there's loads of, you know, question banks out there, and for me, I find it quite useful to go through an exam question, have a look where I've gone wrong, and I use that process to help me to learn like even more. So I quite find exam questions and things like that quite helpful for my revision. How about you, Halima?
Yeah, exactly the same. I like more visual type of learning. It's just more interesting, more fun, and less boring. So I usually use like watch videos, and as Amina said, do a few questions. As you guys know, in A-levels, doing past papers is really important, and the same applies when you're doing medicine. You won't exactly have past papers per se, but there will be questions out there and examples of things you can answer and learn from, and basically get your exam technique from.
Okay, lovely. So what is dissection and prosection with cadavers like? So our medical school, we've only experienced prosection, so we can tell you a little bit about that. So essentially the cadavers have been all pre-prepared for us to have a look at. So we had like, I think it's like about 10 tables around the room with different specimens on them, and you'll go around to each table, and a demonstrator will sort of explain all the structures for you, and you get a sheet beforehand to show you what sort of specimens that will be in that particular session, and you can do some pre-reading on that. I guess I wasn't too much of a fan of that, so it didn't help me too much with my learning, but I think that's just the type of learner that I am. But what was your experience with that, Halima?
So prosection is probably going to be the first time you see it's going to be the first time you see a dead body, and the first time you actually see the inside of a dead body. So it is quite an experience. It's quite also unnerving at the same time. You don't know what to expect. And the environment, you've got smells, you've got the visuals, and it's a bit all like overwhelming, but it's a really nice way to learn. For me personally, I watched prosection videos before I actually went into prosection, which makes it so much easier to identify things in real life. And also these pro-section samples, they won't be fresh. So don't be surprised when you see them without, and they don't look exactly how you expect them to. But it's a really interesting experience, and it's something that you're probably going to do only once throughout med school. So definitely make use of that opportunity to learn your anatomical structures, just to see the inside of the body really, and to put pictures to what you learn every day in lectures about like muscles, and you get to see them in real life and how they function, etc. And also at University of Birmingham, they do have intercalating course for clinical anatomy. So if you do, and if you are keen on dissecting, like a budding surgeon, then you can have the opportunity to do that if you do intercalate in clinical anatomy.
And you get to dissect in that one rather than just pro-section, so that's a little bit more fun.
Yeah, so you get to do dissection.
Yeah. And then one final question, did you do an EPQ in sixth form, and is it highly regarded in an application? So I actually signed up to do an EPQ, and then I thought this is too much work, and then I dropped it off during my first year. So I would personally say it's not essential, and I would focus on like your A levels and everything else. But saying that, if there's a topic that's really interests you, and you really want to go into that and research into that, it would be quite useful, and you can gain some really good skills from that, and I guess even mention those kind of things in your interview and personal statement, but I wouldn't say that it's essential. Halima, do you have anything to add to that?
And I think what you've said covers it all, but it seems like a few people are interested in what it feels like to see a cadaver for the first time, and if the face is covered. So the face is not covered if you see a full body. Seeing it for the first time is kind of a crazy experience, but you do have people with you. You're not just in a dark room by yourself with a dead body. So you're all experiencing it together for the first time. So don't worry too much. Everyone is in the same shoes. But it's quite an interesting experience, and actually probably for you guys, one of the first times that you will see a dead body. So if you feel uncomfortable at any time, then do feel free to walk out, or just to take a bit of a break, sit down. So don't worry too much about it in that respect. It's quite interesting, it's cool, it's quite fun, and exciting if you just learn about the anatomy. So yeah, that's what I would say. But for me personally, the experience, it was quite I don't know how I felt actually. I was excited at the same time and then nervous at the same time. It all felt surreal. That's the word. It all felt really surreal, just seeing all of that in front of you. And also, you won't just be seeing lines and lines of dead bodies. There'll probably be one specimen with a dead body, and then there will be I guess this doesn't make it any better, but a leg showing the muscles, or a hand showing the tendons and the muscles. Or the face. I don't know if it's too descriptive for some people, so they're a bit ugh. But yeah, there will be the face, it might be cut. But yeah, there's that. Does a cadaver smell? Yes, a little bit, but there are ventilation systems in our university which work really well, so that was not an issue.
I remember when I first saw a whole cadaver, it was like Halima was saying, it's almost like a shocking experience. And then I remember on the bus home, I was thinking that, whoa, that was a real person. And then I started thinking all about that, and it is a shock at the start, but then as time goes by and you're going into pro-section a lot more often, you get used to it. And I think one important thing as well is that those cadavers that are being used, people have donated those bodies so that to help medical education, and I guess it's just really important to be respectful, and I guess make the most out of that educational experience. But yeah, it can be a little bit shocking, but you get used to it. And yeah, if like Halima was saying, if you feel uncomfortable at any time, or even a little bit upset by it, that's completely normal. And like we said, at medical school, there's so much support, so you don't you know, you're not left on your own or anything like that. Are there any other questions that anyone has? Feel free to drop them in the chat box.
Or if we've missed anything.
Okay, we've got a couple more coming in. So is there a lot of exposure to blood? So I'm going to throw that one at you, Halima.
In the first 2 years, there's, well, depending on when you go to hospital, there's no exposure of blood at all. In third year, if one of your skills is to take blood, so do a blood test, then you will be exposed to blood in that respect. If you go to surgery, then you will see a bit of blood. If you're in emergency departments, you might see a lot of blood. But if I think about it personally, I've not seen like a major amount of bleeding or anything substantial at all, apart from one little tube of blood. So it depends on your experience really and where you go. Obviously, if you go to theatre quite a lot, then you'll see quite a lot of bleeding. If you go to trauma quite a lot, where patients are coming in with active bleeding, then clearly you'll see a lot more bleeding than just being on the ward and taking little blood tests.
Yeah, so I guess there's not too much exposure to blood as you might be expecting, but there are quite a few medical students that before applying and then at medical school they had a fear of blood, and then there's quite a few that I know have overcome that, so I wouldn't worry about that. There's incidents of medical students fainting sometimes, but once you get used to it and you'll be fine after that. We'll take 2 more questions and then we'll wrap things up. So someone's just asked, how was your medical interview experience? So I would say for my medical school interview, beforehand I was like very nervous, as anyone would be, and that's completely normal. And then during the interview, I would say it flashed by. So I did the like MMIs, and it flashed by, and I think one of the things that I kept in mind was, if one station goes bad, that's okay, and that's completely normal for you to have a couple of bad stations or ones where you feel like you didn't perform as well, and then a couple of others will go a lot better, but I would say it went by a lot quicker than I thought it would, and I just wish that I didn't stress as much as I did, but it's completely normal to stress and things like that, and hopefully our medical school interview sort of webinars and small group sessions that we do in the future will help to ease your stresses on that. And Halima, how about you? What was your experience?
Yeah, like you said, it went a lot faster, so it always feels like you spend all your time revising for your interview and then it just flashes by and you're always like, did I just do the interview? Like, is it already finished? But that's just the nature of how things are. But it does honestly flash by, and no one ever walks out of their interview feeling like they've secured the offer in the bag. There's always room for improvement. There's always something you're going to pick out and think, oh, I should have said this, or oh, I forgot to mention this. But it's a pressured environment. They don't mark you too harshly. They just want an overall impression of you as a human, and that's it really. Don't put too much pressure. But as I said, preparation is key, and this is why we've Mesuccess has put together interview webinars and resources to support you guys, and by attending those you will get the top tips and the preparation that you need for your interviews. Preparation is absolutely key. Revise interview questions, say your answers out loud but not like a robot, and just familiarize yourself with some of the questions that they can ask. And also a lot of universities also post on their website what kind of stations come up. So for example, they may say role play, data interpretation, etc. They obviously won't tell you what will come up within that, but you will get a general overview as well.
And then final question, someone asked what books they would to recommend for preparing for medical school. So I think that sort of Halima sort of answered that already. So I would personally say that you know, there's so many free resources available. So like the webinars we're doing, other webinars, Facebook posts on Instagram as well. So on our Instagram page, we're posting a lot of advice as well as our webinars. So I would say I wouldn't recommend you paying for resources, because like in today's day and age, pretty much everything that you need is available online, and it's available for free. So obviously if there's courses that are silly prices like £100 and books that are £50, you know, you don't need that. And sort of online free resources is all you need, and to apply to medical school, and just looking at the requirements that you need for each medical school, and looking at their websites and things like that is really important. GMC guidelines as well, GMC good practice for doctors, and the General Medical Council has a lot of advice on how to apply to medical school, and like all the different tips and stuff. So a lot of the things that you need are available online and for free. Yeah,
definitely. I was just going to say that one last thing is, one of the biggest advantage that you guys will have coming out of this COVID period or era, actually we're still inside it, but a lot of things have come on, transferred to online, and a lot of resources that were people were charging for previously have now become free of charge and easily accessible. So definitely utilize those resources. And I think better than a book, it's interactive sessions like this that really help, because a book won't answer your individualized personal questions. Over here you get real-time one-to-one feedback when you attend webinars, and you do that face-to-face. So definitely utilize those resources that are being put out there, and increasingly so because of the current pandemic and the way that everything's being delivered.
Yep. And we're going to hand it back over to Annie now, but it's been an absolute pleasure, and I've loved all your questions as well, and thank you for like all the interaction and really really good questions that you've asked.
Cool. Thank you very much, Amina and Halima. That was a very, very comprehensive webinar, and thank you very much for your time and your detailed presentation, and for answering all the questions from our students. The last thing I'll ask from yourselves is, I'm just going to put another link to our feedback form. This is our first webinar that we've run as an organisation, although we've been running for more than over 10 years now. Would really appreciate if you could give us some feedback. It will really help us for the next webinars that you attend. So hopefully you will see tangible improvement if there's anything that we can do to make things better. Our next webinar is at 7 o'clock next Tuesday on the BMAT in particular, which is being done by Mr. Majid Panahi, who is a second-year medical student at the University of Cambridge. So please do complete the Eventbrite, join on Eventbrite. You should have had the email already. And get your tickets for that event, and come and join us, and do spread the word to your friends and to your school, and pass on the Google form link to people to sign up to our mailing list, and we'll monitor that and send out invites to our event near the end of the week to new people that sign up. We have our email address if there's any questions that you have in the interim, more so around the logistics of the event. So we'll just stay online, and this is the end of the webinar. I'm just going to finish off the stream on Facebook. Thank you for those joining on Facebook, and I hope we answered all your questions. Please do feel free to leave the webinar now, and we'll just stay online until everyone's